You're most welcome to today's talk. It's Tuesday the 20th of July. Now, I have got some news from the US and the UK, but some other countries as well today. Let's just start off with an orientation, couple of slides. Cases in the United Kingdom, as we know, bounding up still. But then we see Malaysia, Indonesia, Thailand, those Far Eastern countries that we're concerned about. The United States there for comparison, but unequivocally increasing cases in the States as well. Can't get away from that, absolutely. Putting that in the context of testing, we see that the figures in Indonesia are likely to be unreliable. The figures in Thailand, again, not a lot of testing done. Malaysia, not a lot of testing done. The United Kingdom, quite a lot of testing done. So that puts some validity onto how likely these lower figures are likely to be correct. Indonesia and Thailand certainly likely to be higher. But of course, the United States testing, according to our world in data, and this is accurate as far as I know, is way down. Way down, the testing in the States. So how accurate can we say that these numbers are in the States when the testing in the States is so low, at least compared to the United Kingdom? So an interesting open question there. I don't pretend to have the data to answer that. But an interesting question for US leaders there, I think. What's this one? I thought I'd just show you this one as well. This is the share of people vaccinated against COVID-19 as of July the 19th, 2021. So I'm just going to look at these countries here. So Canada doing best. United Kingdom, Spain, Italy, Germany. Then the United States, France, Saudi Arabia, Argentina, Poland, Turkey, Brazil, Japan, South Korea, Malaysia, Morocco, Mexico, Colombia. World average on that one there. World average. That's kind of the median one, if you like, there in the middle, I suppose. Then lower than average. India, Russia, Peru, Thailand, Indonesia, Philippines, South America, Iran, Ukraine, Uzbekistan, Vietnam, Egypt, Bangladesh, Angola, Ghana, Kenya, Afghanistan, Iraq, Sudan, Nigeria, and finally at the bottom, Mozambique. So this does show the gross low amounts of vaccine in many African and some Asian countries compared to the figures that we're seeing in Canada, the United Kingdom, United States, Spain, for example. So I thought that was quite an interesting comparator, really. Now, moving on to the United States. Delta is now increasing in 50 states. Well, last time I checked, there was 50 states, so that means Delta is increasing everywhere in the United States fairly rapidly. More so in some states than others. So, for example, particularly badly affected in the South, California, Texas, Missouri and Florida are particularly badly affected at the moment. But generally in the States, it is fair to say infections, hospitalizations and deaths are all increasing. The vaccination rate is down. Now, I'll just show you the vaccination status. I know that's in the UK. I haven't got it in front of me for this. Oh, yes, I've got it in front of me for the States. There we go. This is the vaccination status in the States. So, of course, President Biden wanted that figure there to be 70% by the 4th of July, and it's still only about 69%. So, much lower. And the vaccination rate in the States, I mean, I think you could basically say it's pretty well stalled. It does vary from place to place, of course, but the daily vaccination rate is down really quite dramatically. So although these numbers are going up, of course, they're going up really pretty slowly, which is really quite unfortunate. Now, to illustrate that, my concern here, this is the graph for emergency department visits with diagnosed COVID-19, sort of December, January, February, March, April, May, June, July. So, but the point is we see this up, down, up, down, up. Now, not too surprising, but then when we compare that with the diagnosed infections, we see that there's quite a close linkage. So there's the shape of the diagnosed infections, and we see this increase here that correlates with this increase just correlates with that increase just there. So, in other words, what we're seeing is that emergency department visits are following the increase in cases. In other words, the linkage between cases and hospitalizations in the States is still relatively strong. Now, I know this isn't hospitalisation, this is ED visits. Hospitalisations will be slightly low, but the linkage is still there. So in the UK, the linkage is largely broken. In the States, it's broken to a somewhat lesser extent. Now, of course, there'll be less people getting severely ill, being hospitalised and dying in the States because of the vaccination programme that's been relatively good. But that slowdown is a concern in the States. So diagnosed infections are leading on to an increase in emergency department visits, is the point. And that was the vaccination site that we've just looked at. Now, the debate about masks in the United States, I think it's fair to say, has been well and truly reignited. So Los Angeles, for example, now mandatory mask wearing again. Let's just compare this with the teachings from the American Academy of Pediatrics. That's their website there. They're advising all over 2-year-olds should wear masks at school and in enclosed places. Surgeon General Dr. Murthy agrees. So the Surgeon General's agreeing with that. And more the CDC, who are saying that doubly vaccinated people don't need to wear masks in public, are looking a bit out of touch. So basically, Los Angeles are saying everyone should be wearing masks regardless of vaccination status. American Journal of Pediatrics and the Surgeon General. So the CDC is looking a bit out of step, and as the Delta variant increases in the UK, the CDC will be looking increasingly out of step. Dr. Francis Collins, Director of the National Institutes of Health, again, waded in very much on the side of the American Society of Pediatrics. It looks like it's going to help. If it looks like it's going to help, put on a mask for a while. Why not? Why not? And his implication there was it is a good idea. Now, here in the UK, I don't think we realise quite how bad our cases are. Well, we do because we've seen the graph, but compared to other countries in the world. So quite sobering to reflect. The State Department and the Centres for Disease Control have avoided all American citizens to avoid travel to the UK. Not banning it, avoid it, and be fully vaccinated if you must travel to the UK. So there you go, our cases are shooting up, and of course the jury's still out on what that's going to mean. We're going to know that in about 3 weeks' time. We're not going to know that quickly because we have a 3-week delay in the effect of the easing of restrictions. We know cases are going to go up. We know hospitalizations are going to go up. We know deaths are going to go up. We're sure cases are going to go up a lot. We're much less sure about hospitalizations. Is it going to be up to 1,000 a day? Yeah, it's going to be up to 1,000 admissions a day. Is it going to be up to 2,000 admissions a day? We really don't know. We really hope not. But it is going to go up to 1,000 admissions a day. And deaths could well go up to 100 per day. Going up into August, probably peaking in August and starting to go down. We don't really know, but going down by mid to late December we would expect, unless, of course, further measures are introduced, which we don't know yet. So that's better. We've looked at what's happening in the UK already. India, great to see the cases going down in India. 30,000 new cases in the past 24 hours, 374 deaths. Still a lot, but much less than it has been. But this chap has done some research, Indian government former chief advisor, with some other researchers. And they have just written a report which is showing that deaths in India are 10 times higher than the official figures. Now, we looked at fairly specific research about this, where researchers looked at the death figures and simply counted the number of cremations in particular towns, and they found out the numbers were 3, 4, 5 times higher. But this report, based on larger scale data from India, could well have been times 10 of the deaths in that huge second wave in India, and of course a third wave in India can't be ruled out. So January 2020 to June 2021, 3 to 4.7 million deaths in India are quite feasible. Much larger scale tragedy than the 414 official deaths that have been registered. So pretty sobering there. We knew it's much higher, but to say it was 10 times higher, More data needs to come, but that's looking like a fairly good study, and it really is quite alarming. Now, Australia, again, so frustrating in Australia. They've done so well for such a long time. Jurisdiction. New South Wales, which of course is the Sydney area, active cases pretty high. Now, the key thing here is not so much the hotel acquired cases, it's the locally acquired cases. So 78 locally acquired cases indicating community transmission mostly in the Greater Sydney area and New South Wales. Northern Territories, no new cases. Queensland 1. South Australia, well, a few more cases here, 18 and 3. And Victoria, the Melbourne area, again, 96 and 12. And South Australia now, along with Victoria and New South Wales, is introduced restrictions. So we see the problem worse there, still in the Sydney area. That's very much the epicentre. But we are seeing some community spread, as we see in, 1 in Queensland, 3 in South Australia, and 12 in Victoria. Western Australia, the 15 cases, but they know about all of those, no new ones. So community spread rumbling on in Australia, and I think we have to say the jury is still out. Is Australia going to get on top of this with the Delta variant? What we can say for sure is it's harder with the Delta variant than it was with previous variants. Moving on to the UK. So the vaccination programme continues apace. 88% have had the first dose, 68.8% the second dose. But of course, this is only referring to the adult population. Cases on the week, of course, dramatically up by 40% on the week. Deaths up 60% on the week. Patients admitted up 34% on the week. And if we just look at the cases today, perhaps, of course, we know that they're increasing dramatically. They're going to exceed these cases. This wave, of course, wasn't fully diagnosed, but there was good testing here, and the cases in this wave are going to greatly exceed. They're going to go up way more than that in the next weeks. Of course, what we're hoping is that hospitalizations don't. And we see the difference in the increase there, much less. But still, when was this updated? I'm not sure if it's today or... updated today. This is 20th of July. Updated it to 4 p.m, 1600 hours. So this is bang up to date. Hospital cases, 745. So these are going to go up to 1,000 admissions. The amount of people in hospital perhaps not climbing as much, which is good. And the reason for this is most people being hospitalised aren't as sick and aren't staying in hospital for long, which is really encouraging news. So even if the daily admissions do go high, we still need to keep an eye on how many people are being retained in hospital for longer periods of time. And so far, that number is relatively low compared to the pretty horrific number, 38,000 there. Now we are on about just over 4,000, 4,500, just over 4,500. So the amount of people spend in hospital is also going to be quite critical in the equations and the balances the government's going to have to make. Now, Myanmar, the country that used to be called Burma, I've actually got some sources in Burma. I can't say more than that. Things are bad there now. But rather than talk about any sources, I'm going to go through a published source. So population of Burma, 55 million. Doctors apparently, according to this article, have gone underground as part of their civil disobedience campaign. So they're visiting people on the quiet, as it were. Half of the population will be infected within 3 weeks. Delta variant, alpha variant as well. So the alpha variant, very contagious. The delta variant, even more so. This is on Times of Asia. But as I say, I have had several emails from Burma as well. No hospitals accepting patients anymore, apparently. Virtually no oxygen. Any oxygen that there is retained for the military elites, according to this article. Most deaths are untested, so the actual number we don't know. China has closed the border between Myanmar and China, but China is vaccinating and treating some of the border ethnic groups near the Chinese border, which is good to see. A few thousand Sputniks have arrived, but when I say a few thousand, I mean literally a few thousand Sputnik Vs, virtually probably about 10,000 or so. Very, very, very small amounts compared to the population. So what we're seeing is a whole population here with essentially no access to healthcare. Although doctors can visit, but without oxygen and without drugs, what they can do is very limited. 55 million people with a surging Alpha and Delta pandemic. Half the population to be infected within 3 weeks, the wave carrying on for quite a bit of time after that. Without medical care, we could well be seeing deaths of about 5% of infections. So it is not ludicrous, and the references given in the article are higher than this, but we could see several million deaths in Burma due to the lack of medical care as a result of the political takeover in Burma and Myanmar. So it's remarkably bad. Already there's a black market in oxygen. Already people are looking around on social media for oxygen that it's very, very difficult to find. There is some oxygen production in Yangon, which used to be called Rangoon, but other parts of the country, essentially nothing. So quite clear that there are currently unnecessary deaths in Myanmar. Quite clear that there's going to be a million or several million more, and equally clear that the rest of the world is not going to intervene in that situation. So just spare some time for the people of Myanmar in that difficult situation. Indonesia, there's another Eid coming up, people travelling around the country, cases increasing as we'd seen. Olympic Games, 71 infections, either going to carry on or be cancelled. Your guess is as good as mine. Right, so that's us for today. Now, I've got a new video series to start showing you. It's called Wefwafwa Goes to Do Community Healthcare in the Villages. Well, I've just made that up. But I asked Wefwafwa to record some videos of his work in Uganda, you'll remember. And do watch the interview with him. Very poignant interview if you didn't see that. And we're going to play about 5 minutes of this. I just find it a very relaxing video to watch, actually, but packed full of good stuff. And let's watch that now. And of course, I will be posting the link to the original Wefwafwa's site for this, which I encourage you to go and visit and do the like and subscribe thing and help him in his work. So let's over to Wefwafwa now. Thank you, Wefwafwa, of course, as always.
Hello everyone, welcome to our channel. This is Wefwafwa Andrew. As I promised, finally we are here in the community. Last week I uploaded a video and I promised you guys that we shall be going to the community, visit our people from there, screen some deadly diseases like hypertension and diabetes mellitus. And finally, God has made it possible. And now we've made it a bit different because we want to be planting some nutritious plants wherever we go. I realize that our people in the village sometimes also don't have money to buy things like maybe fruits that we recommend. So I thought it wise to be going in villages and planting some fruits as well. As you can see, we have here an orange seedling and we have also a moringa seedling. So these seedlings, we shall be giving them out wherever we go, and we are going to be planting them, and we expect them to help our people in a nearby future. So we are going to take you back where we started from. So early in the morning at around 8 a.m., we went to buy some seedlings for the fruits that we want to plant. We started by buying seedlings of moringa and oranges because they are a bit affordable and nutritious as well. From there, we got a border guy who took us to Doko. Doko is also found in Mbale, and Mbale is found in eastern Uganda. Now, someone may be asking that, what is Uganda? Well, Uganda is also a country, and it is found in East Africa. We are bordered by Kenya to the east, South Sudan to the north, DRC Congo to the west, and then Tanzania, Rwanda, and Burundi to the south. Uganda is a landlocked country, and it is also referred to as the Pearl of Africa. Actually, this name was given to Uganda by Winston Churchill in his book titled My African Journey. Uganda was also a British protectorate, so he was sent to Uganda as a parliamentary representative. And so in his book, he described Uganda as the Pearl of Africa after he traveled throughout Africa and he came and saw some amazing features that we have in Uganda. Also, Uganda is a low-income status country. Now, viewers, you will bear with me because I was using my phone and I was seated on a motorcycle and the road was also narrow. That's why you see that the video is shaking too much. But I believe, God willing, we shall be able to acquire a better camera such that you will not be getting these disturbances. As you can see, we are heading to Doko, a village near the city, but as you can see, it is somehow a long distance, only that I tried to clip out some videos. It is a long distance, and those people have to move from wherever they are to come to town, maybe when they need medicine, and so sometimes they find it really difficult. Yeah, this is because when they imposed the lockdown, there are some restrictions that were imposed. For example, the border guy is not supposed to carry a passenger apart from us, the health workers. Yeah, so that is it. But some people end up breaking the regulations because they have to survive, and it is really difficult because they need to eat and do all those things. As I told you, the video quality is not very good because we were on a motorcycle and the camera of my phone was shaking, and because the road was also narrow, so we had to just struggle. That's why you see we were trying to dodge people as we were moving, and that's why you see it shaking. So I hope you are enjoying this video. If you have some ideas that you think can help us improve these videos, please let me know in the comment section such that we can improve these videos. Again, if you have also ideas concerning what we should do in the community on top of what we are doing, please also feel free to comment down there in the comment section and give our video a like. And also, don't forget to pray for such communities. Don't forget to pray for us. We need God to protect us as we move in these communities, and we need God to provide for all the resources that are needed for us to run these activities, and above all, we need His wisdom. So I think we are nearing the home where our mama is found that we visited that day. Yeah, it is very near now. So let's go.
Right, now if you want to find out what happened when Wefwafwa got to Doka, you're going to have to watch tomorrow's episode. If you can't wait till then, I'm going to put the link to Wefwafwa's own site. No, seriously, do try and go to Wefwafwa's own site and watch that and boost his numbers a bit. And next time we'll look at the patient that he visits and talk to the patient that he visits in the village. Now, you mentioned there high blood pressure, very, very common, hypertension. Now, the main clinical feature of hypertension is that there's no clinical features of hypertension. So the blood pressure goes up, it causes progressive organ damage and heart damage, kidney damage, brain damage, strokes, all the arterial diseases really, and it just causes all that damage. And if you don't take the blood pressure, you often don't know. Some people get headaches, but a lot of people get no symptoms with high blood pressure, so it's very important to screen. Likewise for diabetes. Now, Wefwafwa there mentioned diabetes mellitus. There's two types of diabetes. There's diabetes insipidus and diabetes mellitus. When people are talking about diabetes, they normally mean diabetes mellitus. There's two types of diabetes mellitus. Type 1 diabetes mellitus, which is autoimmune, and always needs insulin. Type 2 diabetes mellitus, which is non-autoimmune and is caused by insulin resistance and insulin deficiency. Lots of videos on that if you want to watch it. But the point is, again, it's very often silent, minimal clinical features, damages the organs, causes blindness, heart disease, cerebrovascular disease, cardiovascular disease, peripheral vascular disease, renal failure, terrible disease. All of these side effects can be prevented or at least postponed for a long, long time with good management. But of course, if the people aren't diagnosed, they're not picked up, then they just get progressive organ damage. And that's what this video is largely about, that he's going to screen people. And he shows us one example on tomorrow's video. So anyway, I'll put the link on there. If you want to see the rest of it, you're welcome to do so straight away. And I just find it strangely relaxing to watch. So thanks for that, Wefwafwa, and thank you for watching this video.